And I will be talking about my dissertation prospectus today, the effects of music and movement-based curriculum on academic performance in high school students. My problem statement is, would it enhance academic performance in high school age children to incorporate music or movement activities into their school day? Most of us either remember, or maybe we have children in preschool who are learning through music and movement every day, but then as we get older and go up in school years, that's reduced greatly. So students tend to learn in a more sedentary environment. So by enhance, I mean improve test scores, decrease absences, increase their ability to concentrate, show a deeper understanding and interest in the lessons, but then also increase their levels of confidence and happiness. This would decrease the rates of depression, anxiety, and suicide that we're finding in pre-adolescents and adolescents. So the aim of the study then is to show that by adding music and movement activities to secondary curriculum, teen depression, anxiety, and suicide rates will decrease. Academic performance among at-risk teens will improve, and I will talk about what at-risk means in just a moment. Music and movement activities do not hinder academic performance, but in fact enhance it. And I included that because some of the literature that I have read suggested that if we add physical activity into the school day, that then maybe academic performance would suffer, and the results are showing that actually no, academic performance is not hindered by taking some time out for physical activity. This idea came after reading an article called The Decline of Play and the Rise of Psychopathology in Children and Adolescents by Dr. Peter Gray. This is really a meta-analysis comprised of 40 years of literature and research. And Dr. Gray explains that over the past 50 years or so, as opportunities for children to play have continually decreased, also measures of anxiety, depression, and feelings of helplessness, even suicide rates have increased. So Dr. Gray found a causal relationship between the two, and my proposed causal relationship then is, if secondary students are given the opportunity to learn using music and movement, that their academic skills, their grades, their test scores, their attendance will improve, but then also their mood and confidence level and overall mental health will improve, which will decrease those numbers that we're seeing with depression, anxiety, and suicide rates. So my hypotheses are that at-risk high school students who participate in music and movement activities directly related to curriculum will show significant improvements in academic performance, which includes grades and attendance. And at-risk just means students who maybe live in broken homes, maybe are in extreme poverty, possibly even homeless altogether. They also may have issues with drug and alcohol addictions, with abusive parents. Their lives are just really different from the typical secondary learner, and some of the things going on at home may impede their learning and influence their ability to focus and their ability to even like school or make a connection with teachers and friends. The other hypothesis that I have is that at-risk high school students who participate in music and movement activities, again, directly related to their curriculum, will show significant improvement in their attitudes towards school. So academic performance and attitudes towards school. The methodology is going to include a sample of convenience. At-risk students at an alternative high school setting where I teach will administer a pre-test that asks them basic questions about their overall feelings about school, and it'll be a short Likert scale questionnaire. Then we'll have music and movement infused curriculum for 4 weeks for a block of time. That includes lesson plans that have age-appropriate music and movement techniques for them. And then at the end, we'll administer that post-test again to see if there's any difference in the way that they feel about school or school work or teachers or attending school. So we'll look at attendance by looking at the attendance records of the school. We can look at their tardies and absences. We can look at past tardies and absences to compare it with that current block where we'll be administering the music and movement activities. And we can look at their attitudes towards school based on that pre-test and post-test that I just talked about. And then also we can look at academic performance measured by grades at the end of the course block. This can also be, we can look at patterns and see if they have dropped the block in the past versus this current block where we'll be administering music and movement activities, and we can look at their overall academic performance. So the proposed design is pre-test, post-test, non-randomized, quasi-experimental design. And you can see what that looks like. It's non-randomized by necessity, as this is a sample of convenience based on the availability of students. There will be control and experimental groups to generate comparison data analysis. So it will be quasi-experimental. I think the implications of this study are potentially rather large. If depression, anxiety, and suicide rates among teens are on the rise, hopefully we can decrease those by just implementing music and movement activities that stimulate the brain and increasing opportunities for play and art and physical education and music. So it's my hope that just by adding those components of music and movement into the secondary learning system, that students will be healthier and happier and will be able to function better in society. These are my references. I hope you enjoyed my video. Thank you for watching.